Hi everyone, I'm Dr. Karen Leong from Face and Body. Sorry I'm a little bit late. We had a laser demo this morning and I'm getting my cheeks done for the first time ever. I am a filler newbie, but Ashley is amazing and I'm kind of excited, and the hubby doesn't know, so don't tell him. But anyhow, it is Thanksgiving week and we are continuing with our face and neck series, and it seemed kind of fitting that we talk about necks on Thanksgiving because everyone always refers to the turkey gobbler, and we just wanted to address that. Plus, it is still November and we have a $2,000 off lower face and neck lift special that's good until the end of the week. Or if you call in and say, hey, I really want to make it, but it's the holiday, we may be able to accommodate you. So anyhow, oh, thank you. I've got my book. So let's talk about necks. When I see someone who comes in and asks me to treat the neck, there's a couple of different considerations, just like with everywhere else on the body. I'm looking at skin, so whether or not you have excess skin or lax skin or crepey skin. I do a little snap test, you pull and you see if it snaps back. I look at you very carefully to see what you're doing when you're talking to me. So if you come to see me and as we're talking, you just keep grabbing this, grabbing, and you've got some fullness there, that comes into mind, just submental fullness, which means fat or skin or both. For people who come in and as we're talking, they're constantly making this motion, they're pulling, then to me, that tells me that their concern is mostly skin and they want a lift. They're not mutually exclusive. A lot of times these things come hand in hand, but there's a lot of tells when you come to me for that consultation. So there are a couple things that we can do when we're talking about turkey gobbler necks. So I'm going to start from the least invasive and go more and more invasive. Obviously, Dr. Park and I are surgeons, so we want to talk about surgery, but not everyone wants surgery and not everyone is a surgical candidate. Okay, so if we're just talking about some fullness down here, or if when you look at yourself inside in the mirror, it's not a nice 90-degree angle, we call this the cervical mental angle, cervical being the neck, mental being the chin, and we want it to be about 90 degrees. Now, I used to have a little thing there, and I was like, well, it's just a little bit, but it bothered me, so what could we do? In that case, you might be a good candidate for Kybella. Kybella is an enzyme that was originally found when doctors were doing research on the pancreas and the gallbladder, and they found that it melted fat. So it has since then been FDA approved to treat submental fat. So if you've got a little waddle here and you say you've had it forever, if you were born with it, it comes in the family, you may be a good candidate for Kybella. Kybella can also be used to define the jawline and to treat early jowling. Now, this is not intended for people who have a lot of submental fat or for people who have a lot of excess skin, because even if someone tells you that Kybella tightens skin, it doesn't. That's not the intention of it. It may be a side benefit of it because you are causing an inflammatory reaction to the fat. We've done a little test of our own where we injected the Kybella into a little piece of fat that we've taken out from a tummy tuck, and it's pretty mind-blowing. You just watch the fat melt before your eyes. Now, the recovery from Kybella can be a little bit irritating. It takes about 10 to 12 weeks. You feel numb and kind of pins and needles here, and it can swell quite a lot depending on how much fat you have. And then you wait for the body to absorb that fat that's been melted and to excrete it through your kidneys and liver. So that's Kybella. The next step up when you have more than just a little waddle or a little bit of early jowling is doing liposuction. So I feel like liposuction in the neck and jawline is kind of underappreciated. If you have good elasticity of the skin, you could have a really lovely result with liposuction of the neck. And when we do that, the focus again is this submental area and also along the jawline. I typically put my incisions, which are really tiny, smaller than my small pinky nail, right under the chin. A lot of people already have a little scar there from falling when they were children. And then I typically put one on the edge of each earlobe. And that way it allows me to address this whole area coming from 3 different directions. Recovery from this is not too bad. Typically you're in a wrap, and I do like you to keep the wrap on for about a week and then to wear it at night for the next several weeks. And because you want the skin to lay down flat and not to have any fluid collect and not to have any indentations. Again, numbness in this area can last for several weeks to months, and especially in men, I tell them to be careful and not to shave or to use an electric razor after the first couple of weeks. The most intensive, obviously, is surgery, which we call a natural uplift or a lower face and neck lift. This is intended for people who have crepiness of the skin here, neck bands when they engage their platysma muscle, and then also loss of the angle of the neck and chin, the cervical mental angle, as well as significant jowling, all right? And this is for the people who come in and when they talk, they just go like this. Doctor, if I could just have my face like this, or if I tip my face back and it looks perfect, that's what I want. And that's a lower face and neck lift. In our office here, we do this procedure under twilight sedation, which means that you are conscious, kind of like a colonoscopy, but you have an amnesia effect with the medication. We give it something through the vein. You are awake without a breathing tube, but you are in La La Land. So we're able to do this surgery, and we can offer it to people who are older too, without the risks of general anesthesia. Let's see. So this one is a more dramatic result, but you can see here in this patient, as we mentioned, she has that loss of the angle of the neck there, and she has jowls along the jawline, and then she just has that extra skin and extra fat. And you can see that a lot of her face, which used to be youthful and round and high, has now continued to drop and gone kind of below the angle of the jaw there. And then when we do our face and neck lift, now we're looking at a result more like this, where again, you've restored the angle of the neck, you have repositioned the tissues so that the jawline and the jowling are corrected, and you've even lifted part of the cheek area here so that there's more fullness where it's more appropriate. From a full frontal angle, again, you can see the jowls and the cheek area and the marionette lines are improved and softened with this procedure. Now, a lot of people will ask about the nasolabial folds. This is not treated with a lower face and neck lift. This is more of a mid-face issue, and typically when I have people who are concerned about this, we're talking about repositioning the cheek with filler or with fat, or in more extreme cases, a mid-face lift, which is less commonly done than a lower. Sometimes for people who have really, really deep nasolabial folds, what I like to do is to release that, kind of like a scar release, and then you use a little bit of fat to underlay it so that it's softer. In addition, we like to pair our facelift procedures with the CO2 laser so that we can really improve on the texture of the skin and correct a lot of the browns that are present from sun damage over the decades. All right, so when we're talking about face and neck lift, everyone wants to know what the scars are. I typically tell patients that what Dr. Park and I do, each a little bit differently, but fairly comparably, is that we will make an incision following the crease of the earlobe behind the tragus of the ear. That's a little bit of cartilage there, and then up into the hairline a little bit. Now, depending on where your sideburn is, we may put the incision in front of the sideburn or inside the sideburn. And then behind the ear, we're going in the crease of the ear itself. Dr. Park likes to extend his a little bit along the hairline. I do mine a little bit differently depending on your needs, but again, fairly comparable. And the idea behind a face and neck lift is that we are repositioning the structural component of the face, which is the SMAS, or the muscle layer, or the strength layer underneath the skin. We do not practice the New York facelift where everyone gets that very windblown, tight look, where really it's depending on the skin to hold this up. The practice that we both employ is to tighten the skin underneath, whereby we're able to lift in a vertical vector the muscle component so that it will hold everything up on top of it. During my consultation, I always say, it's like making a bed. You need to tuck those sheets in and make tight corners and make sure it's flat and smooth before you lay your quilt on top. If you're putting your duvet over rumpled sheets, you're going to see those rumples and you're not going to have a nice, tight, hotel finish look. You want military corners, and that's what we want too. We want military corners. So we're focusing the majority of our attention on tightening that muscle and lifting it, and by doing that, we can really target the jowls, the marionette lines, and also the neck, okay? And the skin just lays over it. I find that most people are kind of surprised. They're like, well, I have so much skin. But once we reposition the muscle, a lot of times you don't get as much skin as you expect, but you still get this beautifully lifted face. That's very, very natural. We believe firmly in natural. I would not do to my patients, and Dr. Park wouldn't either, what we wouldn't want for ourselves or our loved ones. Recovery from a lower face and neck lift. I typically tell people to take 7 to 10 days off. The sutures are removed around 7 days, sometimes a little bit longer, sometimes a little bit earlier. Neither Dr. Park nor I leave drains in unless there's a reason for us to be concerned about potential bleeding. You are in a head wrap immediately after that, and then we take it off the day after, clean you up, and then you can hop in the shower and do your hair. Most people don't tend to bruise too badly, and then after the sutures are out, you are mostly able to go out in public without too many people saying they've had something done. At 2 weeks, I tell most people that they can go out for a nice dinner, and most people would not know. In terms of recovery, there is always some swelling that tends to hang on the side cheek here. Again, something that you would notice, but maybe the rare passerby would not. The sutures themselves, the incisions themselves tend to heal very well. They fade away to almost nothing. You do not lose hair where we do our surgeries, and there is very little discomfort associated with it. So most people I find are a little bit anxious with the wrap the first night, and then once the wrap is off, they're basically off the pain medication. And I find that most people say that they're surprised at how easy the recovery is. All right, so that in a nutshell is lower face and neck lift, along with a little bit of diversion with the Kybella and also the neck liposuction for the appropriate patients. Again, just as a reminder, it's the end of November, but we're having a face and neck lift special, $2,000 off until the end of the month. But if you call in and say, you're interested in a consultation, we may be able to extend that for you. I wanted to wish everyone a very happy Thanksgiving. Enjoy the food, the company, the family, or avoid it, whichever is your preference. And I will see all of you next week. Happy Thanksgiving.